This interview, discussing the importance of inclusion and the voice of lived experience, is part of a series by the Health and Social Care Alliance Scotland investigating aspects of the proposed National Care Service. This recording was made on the 9th of February 2022.
Hello everyone and welcome to this edition of Alliance Live. I'm Hannah Tweed, Senior Policy Officer at the Health and Social Care Alliance Scotland, and in this episode I'm very grateful to be joined by Meg Thomas. And Meg is the Head of Research, Policy and Participation at Includem. So hello Meg, and thanks very much for taking the time to speak to me today in this very busy schedule. So I'm going to kick off asking if you could tell us a bit about your experience supporting children and young people and their families through your work at Includem.
Yeah, so Hannah, Includem started 21 years ago, and we were started by three social work managers who had come to the end of their local authority social work lives. They didn't talk about retirement at that point. They talked about doing something different. And what they did is they started talking about those young people who had definitely had slipped through the net or been failed by services, and talked about designing a service from the start, about what if a service that met those young people's needs, what would it look like? And we really welcomed the findings of the Independent Care Review 2 years ago now. And what we would have said is actually that was what Includem was doing 21 years ago. We developed a service that was very much about meeting people in their community, providing support not just for the individual but for the whole family, seeing families out with Monday to Friday, 9 to 5. We recognised at that point we were working predominantly with young people who were in conflict with the law and quite seriously at risk in their communities and to their communities. So we were talking about the fact that you need to see those young people at 10 o'clock on a Friday night, if at 10 o'clock on a Friday night's when the most difficulty and challenges for them occurs. So, that was the bread and butter of how Includem started. And I'm really proud of saying that that continues to be our experience of delivering services. But what we've done is expanded now across a broad range. So it's not just young people in conflict with the law. We're providing some mental health tier 2 support. We're providing support in schools around raising attainment, preventing exclusions. We're doing a lot of earlier intervention family support work. So what I'd say is that, we definitely meet the 10 principles of the Promises Family Support and are now delivering it against a breadth of services and across the country. And really proud of the way we deliver services, because I think that service design model from where we started from had young people at the centre, and it continues to have children, young people and families at the centre of what we do.
Which is a tagline and a central sort of mission statement that I think it's difficult not to see them, difficult to argue with that one, and yet it isn't always embedded in so many areas of the system. And what you're describing there sounds like a real interconnected series of different areas of policy, all of which have clear relevance to young people's lives and their families.
Yeah, and what we've recognised over the year is that if you only intervene in this place, that what is beneficial, you're not necessarily making it the right places. So we've tried to talk about it. A pipeline's a terrible term, but it is a good way of describing that you need to have interventions at every point along that pipeline to achieve that sort of systemic change that we want to achieve and achieve. Our tagline is a better life. That's what we want to be about, is giving children, young people and families a better life.
Yeah. And I know one of the pieces of work I've read of yours lately, I mean, I'm sure there's a much longer list that I'm not as up to speed as you are, was the Voices report, which I think was out at the back end of last year, 2021. And I'll let Meg give the more detailed plug for that, for those that are interested, but it's well worth a read. And one of the threads that really came out through that to me was the really significant mention of child poverty and the impact that has on the people you support and those connected to them. I wonder if you could reflect, in the context of the proposed National Care Service and the really broad range of that consultation, how do you think the NCS needs to consider and respond to the concerns raised in the Voices report and in other similar research and what you're hearing from the folk you support, and those connected health inequalities?
Yeah. Let me start by explaining the Voices report just really briefly. So the Voices report, we're really proud of the way we approached that. So what we did was we employed 3 people who'd been previously supported by Includem as young people. They'd be flattered if I called them young people now, but they all acknowledge in their late 20s and early 30s, they probably don't have that title anymore. But we employed them to work alongside a couple of respected researchers to develop the entire model. So they came up with the questions that would ask families, and they delivered those questions. And we were really keen that we approach that model, not just in terms of providing skills to those young people many years after they'd worked with us, but to ensure that actually they were using language and they were using their lived experience to have real conversations with the families who engaged in the research. And we were really clear the way they asked questions and their ability to share their own stories elicited very different information and levels of trust than I think would have existed if we'd just done it as a group of researchers. And I think they use that lived experience both as young people supported by Includem then, but actually even now in their lives, to be able to break down those barriers and to talk to families about, here's my experience of poverty. Lots of families, when we initially asked, how do you do financially? It's okay, we make do. And then with a little bit of prodding from the researchers and a little bit of appropriate self-disclosure, we had families overcoming that shame, overcoming that stigma, and being able to talk more broadly. And I think that what we found in the Voices report is, as you expect, a whole intersectionality around difficulties. We know that poverty causes significant problems around accessing education, around poor quality housing, access to play space and green space, access to activities. And equally, poverty means that these families are more likely to come into contact with services. So this, what we got was a really complex picture from families around what did it feel like to interface with services, what did it feel like to interface with poverty, and that those two things very much often felt like a catch-22 for them, that to seek support because they were in poverty, often they were then judged for it. They felt that was then brought up in children's hearings perhaps, or in social work reports, that was around neglect or failing to meet their children's needs. So they were then saying, look, we don't talk about it. But equally, they were saying that when they do talk about things like they're seeking out support from CAMS or from another service, they're not believed or they're not heard, or actually their assessment of need is discounted by a professional assessment of need. And so what you had was families just saying, this is a really difficult system to navigate and we can't navigate it and we don't know how to get in that door the right way. And actually often when they are drawn into services from their family's perspective, it's for all of the wrong reasons. It may be a criticism around parenting, it may be a criticism around how they're caring for their children, and they say, but hold on, I was asking for help back here when it didn't do. And I think, from the National Care Service perspective, I think we have to listen to those voices, and those voices aren't saying anything that actually the 5,000 people who involved with the independent care review said as well, that a simplification of services at the grassroots where it's needed, community-based, and actually families being in charge of when they get services, who they get services from, and for how long they get services. Because that's the other thing that was another theme in the Voices report, is because families' control of services, even getting in the door, was limited. It was equally moving on from services, they lacked control. So lots of families saying actually, because it was commissioned or paid for by statutory services, those services were often pulled from them before families were ready to have them removed, and they weren't supported to move on in a really self-sustaining way. And so families just talked about feeling really out of control about all aspects of their services. And I think the other thing that came loud and clear through the Voices report, but other pieces of work, consultation pieces of work we've done with families, is this sense of it's not our plan. We get drawn into these services, often at times we don't want to be in them, and then when we're in them, it's not our plan. We try and talk up, but it's everyone else's plan. And I think, when we think about the National Care Service, when we think about that bit around how do we consider and respond to families' concerns, that's what we need to have some consideration for. And I think something that we certainly have a lot of questions about, I wouldn't, they're not concerns, they're just questions about how does a national system provide community-led grassroots resources that families are in control of? How will the National Care Service ensure that the findings of the independent care review, the promise, are kept? How do we respect the voices of so many to make sure that that's done? And if you think about Laura Lundy's model of participation, absolutely, for the first time ever, I think the independent care review created that space. It created the opportunity for voice. It absolutely created an audience, and it definitely had influence. And I think there's concern across the children's services sector, particularly in the third sector, that actually is that influence going to wane in a national care service? And we often talk about, and I'm probably getting onto things that actually Snow's told me to talk about much later on, but that parity of services. So if you look at the National Health Service by way of a model, so much is in the adult services and children are almost an afterthought, or we are responding to people who are already unwell or people who are already requiring care, instead of doing that preventative piece. And the National Care Service, from a children's perspective, needs to ensure that we take what was fundamentally the finding of the independent care review around preventative services, getting in early, actually before even statutory services are involved, to make sure families have the support that they need. How does that fit with the National Care Service, which automatically puts more structures, more things in place? And if you think, from our point of view, we what came out again in the Voices report, though this isn't the language, of course, that families used, is that social determinants of health. What the families were telling us is poverty's an issue, education's issue around exclusion, around part-time timetables, housing an issue. Lots of times housing gets in the way. I heard a horrific story the other day, which I have permission to share, where a family were seeking support from CAMS in relation to one of the children's behaviours. CAMS acknowledged that they needed support, but said they weren't going to provide the support while the family were in an overcrowded situation, because some of it was around the sharing of bedrooms and things in the children, that meant any work they thought they would do would be undermined by the living circumstances. But at the same time reported them to social work around real concerns about the family dynamics that the family had no control over, because it was around housing and overcrowding. And I think one of our really big questions about the National Care Service is there's a whole heap of places, and our theme, I guess, is around transitions. If the National Care Service has been set up with the idea that we prevent transitions or we minimise impact of transitions between children and adult services, has it considered all the other places that children interface with where there are needs of services? So early years isn't considered in there, and that's one of the biggest transitions for young people, early years into that. Education hasn't been sat there, housing hasn't been sat there. And what we found in the Voices report is the family saying all of these things, those social determinants of health, are key in this. And our concern is that the National Care Service, particularly, we don't know what it will look like yet, but if it's modelled along the lines of the National Health Service, is that it will be too health driven, or formal care. It will be around those who are already needing care, not that preventative piece. And actually, will we create more transitions or more boundaries for these families? If you take school, for example, that's where young people have the biggest interface with statutory services. It's not health, it's school. If you think about what teachers are being asked to do, they're not being asked to deliver a curriculum anymore. They're asked to deliver mental health support. They're asked to identify extremism in families. In young people, they're asked to deliver a SHRI curriculum. They are being asked to do so much that is care, fundamentally is care. And part of that's around the getting it right for every child agenda. Again, from a children's rights perspective, entirely what they should be doing. but where do they interface with the National Care Service? And I'm conscious here that Hannah, I've just gone blah at you, but I guess it's from out that's what it feels like in the third sector just now in children's services. Is, are we yet again an add-on without the consideration of what does it mean for children? The other point I'd make around education, which actually I haven't heard other people making just now, and I really want us to see if we can actually create a collective voice in children's services around. Scottish Government has already announced a huge overhaul of education. They are currently reviewing SQA. They are currently reviewing the Curriculum for Excellence. They're currently reviewing Education Scotland and its role. They're currently reviewing what will schools like for children. So if you think about the lives of the children just now, we have a generation of children who've had an unprecedented global pandemic, and they're now facing into two of the biggest restructures on a government level ever in terms of a restructure of education, which is the interface they have most with, and a restructure around care. What does that look like for these young people, and how are we hearing from them to influence either and both of those? But I don't think anyone stopped and thought about what that looks like. See, if we were adults and someone said to us, we're going to restructure the entire National Health Service just now, and we're going to restructure the care service just now, or we're going to restructure the way in which unionisation or workforce is delivered, as a group of adults, we would be saying, hold on a second, that's a lot of change at once, and how are they working together? And we know governments are siloed in their thinking, and that's our biggest concern at the moment. Where's the crossover around the reformation or the change of education and the National Care Service? And can we actually stop and think about what that means for children?
I think there's a huge amount in there, and I'm trying to work out what bit to pick apart to respond to first. I think the thing that's coming through loud and clear, and I think I absolutely agree with, is how do you not being a personal you in that sentence, how do we as a sector, as a country, meaningfully involve children and young people and their families, both in this and in all of these processes? Because I think discussing this as part of an interconnected policy environment is essential. I had a question on education. I'll get back to that later, because I feel like we're moving in that direction. But I guess I have philosophical questions about that, but also practical ones. What would you see as the key asks for making that involvement meaningful? Yeah,
I think that's a good question. I think the first one is, we've already asked children and young people, and that's the bit we can't lose sight of. We've had 5,000 voices tell us in the independent care review, and I know that was just about care and it didn't necessarily ask about education, but we've learned something around how that process was conducted that absolutely we can go out and do more of. The other report that we released last year was the voices of young people in schools. It was a school experience report. And actually those findings were really, really interesting, because we asked young people about their experience of school in the pre and during COVID period. And we expected young people to tell us about their experience of home learning. We expected young people to tell us about what they needed to catch up in relation to exams and things. And remembering that the young people we support are young people who are definitely in the 10% of the school who are often subject to exclusions, other ones that would be talked about having the poverty-related attainment gap, that are disengaged from schools in lots of ways. What they talked to us about, Hannah, wasn't any of those things. They talked to us about a parity of esteem. They talked about mutual respect. They talked about opportunities to form meaningful relationships with adults in the school that were of their choice rather than imposed upon them. So just because your guidance officer is your guidance teacher doesn't mean that's who the child will choose to talk to. They talked about the use of restorative practices. They didn't use those terms, of course, but that judge me on a new day, don't keep bringing up the past mistakes, but particularly that, restorative practices are already used in schools peer on peer but they were saying we need to be able to have those conversations with teachers. Actually, a lot of the relationships that we have in schools are really problematic because it's around that dynamic between teachers and students, and there's not a parity of power that allows us to address those. And actually, I think if you take what they've told us in that research and you extrapolate it out to answer your question, it is about giving children the space, the voice, the audience and the influence, again, Lundy's model, to actually say, what is it that you want here? But also recognize that what we say here a lot at Includem is governments work in silos, families don't. So the education reform needs to happen not in a silo of education, and we need to not just be asking young people about their education experience. We need to ask young people about what impacts on their families and what needs to change. We talk about that in the context, everyone talks about fuel poverty, period poverty, food poverty. Our families don't have fuel poverty, period poverty, food poverty. They have poverty. They have destitution. So let's start from that level of talk to us what it's about, means from your family. What's that about? What does that look like? And what do you need the systems to change to do that? And I think we won't achieve the change we want on any of these organizational levels if we continue to ask siloed questions or talk about siloed change, because we don't work like that. Your family, my family, we don't see housing in isolation to everything else, or education in isolation to everything else, or care in isolation to everything else. And if you think about that classic mum, and I will use mum because that's where lots of the unpaid caring responsibilities sit on, for that mum in a classic Scottish family who maybe have young children, some of which are in early years, some of which are in primary school, some of which are in secondary school, perhaps an elderly parent that they're caring for, maybe an in-law as well, perhaps they're in insecure employment or in the care sector. Talking about a national care service from their perspective is not going to be a national care service. It's going to be really individually, how does this make my family work? And if you exclude those bits like the early years, or exclude those bits where it interfaces with education, you're not going to have a service that meets families' needs. And one of the things that we've talked about a lot is this sense of, if Scotland meets its poverty targets that it's set legislatively, it still leaves 10% of children in poverty. And that's actually, by rough calculations, at least 50,000 young people. That's a significant number. And actually, if you take that philosophy, let's not talk about the 90% who have, let's talk about the 10% who haven't. And let's design a service that meets the needs of the 10%. You will actually design a service that meets the needs of everyone. And you talk about universal service provision and the danger that targeted service, universal service provision doesn't meet those with targeted need. But actually, if you design universal service provision around those that need targeted interventions, but design it universally, you will deliver a service that meets the needs of all. And that might sound very utopian, but actually that's the conversations we need to be having with families. What does it look like for you as the 10% to make a difference? And let's design a service around that.
Yeah, and I think that really ties back to your comment earlier about not being an add-on, about not being an additional thought as part of major design. It's not just the importance of that, it's of centering attention on the 10%, to use your phrase. It's on the benefits of that to everyone.
Yes.
If I can frame it like that. Sustainability.
I mean, I was using this example yesterday. My son is autistic, and we've been at lots of conversations with his school about the things that need to be put in place in order for him to achieve his potential. And every time we've come out of those meetings, my husband and I, who was an ex-teacher, say, but actually, that would help every kid in the class. So that's that mentality. Actually, if you design something that helps the ones with the most barriers, you will actually overcome barriers for everyone. And I think that's what has to be at the heart of whatever the National Care Service looks like. Let's design something that overcomes the barriers for the 10%. Let's find those families who are least heard. And that's what we wanted to do in the Voices report. We wanted to amplify and absolutely privilege the voices of families who otherwise don't speak up. These are families who've been engaged in services all of their lives, are incredibly distrustful of services because they felt services were done to them and not with them. Let's find a way of talking to those families around what does a national care service look like, and let's design it around overcoming the barriers for those families. Because if we do that, we'll have an absolutely fantastic national care service that definitely does what everyone wants it to do here, which is ensure there aren't transitions, ensure that families actually have least interface with services, that actually they get the right services at the right time, and the services go away and talk about over here, so the family are just having one person who's in contact and they're telling their story only once, maybe twice, not over and over again.
Reducing that trauma of repetition, increased communication between different departments, less time demand.
Yes.
People who, and when I say people, I mean both the individuals accessing or needing to access support and the individuals delivering it.
Yes.
Reducing the time pressures has win-wins for everybody.
Yeah. The number of times I've heard recently people describe themselves as their own care managers, as opposed to being mum or sister. I mean, even actually Pam Duncan-Glancy was saying that the other day in a cross-party group I was in. You know, she described her parents as her care managers. This is not exclusive to families. We need to find a system that lets families be families and let care be care, and care is managed for them in a way that is the least complicated, so that actually they could just get on with being families.
No arguments. I think this may have answered sort of my penultimate question for this interview, but I'm just going to ask it to see if there's anything else you wanted to expound on it. We've discussed here quite a few of the challenges of the proposed NCS, and both in its breadth and in its potential siloing. And I think, you know, these are legitimate, and I think there's a lot of concern that I've certainly been hearing in these conversations I've been having with, like, across the board. But the flip side of that is that potential that you were outlining there about the better outcomes for people, which is the bit that matters and that people want to see improved. How do you think the NCS could potentially see that improvement happen for the children, young people and the families you're working with?
Yeah, I think it is that simplification of systems. If it's done right for families, actually they don't feel like they have an interface with education, an interface with housing, an interface with care, an interface with all of those things, that actually that happens somewhere else. And so from that children's rights-based approach, from the 10 principles of family support outlined by the promise, that actually it's delivered locally in communities and families are in control of that, I think, you know, that will make a huge difference to families. And I think the other thing that would be a real benefit is this sense of, you know, just now, particularly if you take that example of that wee mum again, you know, at the moment they're interfacing with adult health and children's health, adult social care and children's social care, maybe with the criminal justice system, maybe with housing, you know, all of those things. Actually, if we create a national care service that truly does stop transitions, and that's external transitions, not just up the way transitions. And I think that's the challenge actually, is let's think about all of the transitions that happen sideways as much as the lineal ones. And I think, you know, there's a danger if we just look at the lineal ones, we'll miss those bits. But, you know, if we truly design that service, then you've got something that feels really seamless. And there is a sense of, I know the one person I need to talk to, and be confident that all of these other things will then happen. And again, that let's design it for the 10% of the least. The biggest thing for me needs to be this service, the National Care Service, to be successful for families, needs to address the structural issues and the structural things that they're facing. We were really disappointed when we read the consultation for the National Care Service. There was very little in there about poverty. There was very little recognition of the impact that poverty had on families. I was reading on Sunday the Health Foundation report on what makes us healthy, social health determinants. And there were some terrifying statistics in there that, there are statistics that I've been well aware of. Nuffield, for example, have definitely demonstrated that if you are in poverty, you are 10 times more likely to come into contact with the child protection system or to come into care. There were some stats in there that I hadn't known. Things like, if you live in an area of deprivation, you are 9 times more likely as a child to be significantly hurt or killed in a traffic accident than as a pedestrian than if you lived in an affluent area. So these impacts, there are impacts around housing, there's impacts around access to green space, there are impacts around transport, which hadn't even occurred to me, that and we know that that's going to get worse. We've got a cost of living crisis. We have fuel. I filled up this morning and nearly had a heart attack in my car. Thank goodness I'm not using it very much anymore. We know there's some research that's come out of England that is expecting the increase in the number of children to come into care in England to at least be 5% greater in the coming year. And that was just about the pulling down of the £20 uplift of universal credit. That wasn't taking into consideration the cost of living crisis and all of the other things that are coming. So for the National Care Service to be successful, it has to address the structural pieces. And again, if it does that well, that comes back to that 10%. If it addresses those 10% needs. But we have a really significant concern in the children's sector that we just don't have. It's not just parity of esteem, it's parity of funding. There is little recognition from a funding perspective of the complexity of the work we do, the impact of that spend to save, that actually if we get it right for this generation of children, we are going to have a knock-on economically for generations to come. But because of the reactive way in which we budget and the reactive way in which we spend, and so we just keep ploughing money into solving existing problems. So we're providing health and care once health and care needs have presented, rather than providing the funding that does that preventative piece. And that's where children and families care and third sector care particularly come into play. We're providing that really preventative piece. But for example, the recent Scottish budget announced a wage rise for those in adult social care. That's not there for children's social care. You read, everything. You look at the mental health budgets, the CAMS budget, we can have 5% of the budget for children's CAMS. Like 5% of the mental health budget. Where is the preventative bit around understanding that those young people who are experiencing poverty are more likely to have mental health difficulties? Why are we putting so little monetary spend into these services? So I think for the National Care Service to be successful, not just now, but actually make that long-term impact, which is what the Scottish Government is so keen on doing, we have to look at those structural pieces, and we have to ensure that parity of funding for both families and children. So children at the core getting the funding they need and the services they need to do that preventative bit, but that needs to extend out to service providers as well. Child Poverty Action Group did some really interesting research last year that talked to social workers about what gets in the way of enacting the care plans and achieving changes with families. And the answer was resoundingly poverty. Families are too worried about paying their bills, too worried about a roof over their head. They're not in a position to be talking about Solihull models of, providing containment to their child or reciprocity. They're just not there. We're not going to make a difference, and we're not going to achieve change in a social care setting unless we address first that real structural inequalities that exist.
Yeah, and that is a difficult, complex challenge, but it's one that if we don't meet, none of this is going to be embedded it throughout, and you won't see the potential realised of the proposals, I think.
And we need to look at making sure we've got a social security system that actually is sufficient. And I was listening into a talk really interestingly the other day about furlough. And furlough actually has been the biggest social security scheme we have seen in our generation, but actually the general public don't see it as social security in general, in terms of if you make that link between universal credit or those people who need income support, if you ask the general public, they would be all for fur law, but they're absolutely not around. So how do we engage the public around recognizing the benefit of fur law as a social security system, and why is it therefore not needed for those who have the least in our communities?
I've now got an entirely separate Alliance Live I want to do on furlough and social stigma around social entitlements.
Yes.
You've started me on. I'm
Good.
not going to start it now because this is towards the end of this interview, but that's, yes. I've got a final question that we've been asking to everybody as part of Alliance Lives, and I think it's really interesting in the breadth of responses it draws. So you can take this as flippantly or as seriously as you like. It is entirely up to you. Can I ask what matters to you?
Yeah, snacks. So told me to say snacks, which isn't actually true. You know, it is fundamentally, let's design things around those who have the most barriers, because it actually is beneficial for all. And you know, that's really deeply personal to me as a child who has lots of barriers to overcome, and knowing that what would work for him will work for all. But it's also professionally really important to me, because I just think the families we support have more barriers than anyone else, and no one's designing things with them, and we continue to design the services we think they need rather than what they tell us they need, and so we just keep perpetuating the same problems. So voice has to be at the heart of it, and we have to make sure that we're getting them to design for us the services that would help them, and absolutely that'll make a difference for everyone.
Thank you for that answer. Yeah, that brings us to a close of this interview, and there's so much there that I feel there's more to unpack. But I'll end with a sort of final plug and direct, if I may, that if people want to follow up on any of the topics that you're outlining within your work here, then your website, www.includem.org.uk, correct me if I'm wrong.
No, that's the right one.
Good stuff. Is the place to go to get in touch with you and to see more about the various research and work centred around lived experience and support for children and young people that you're talking about. And if people want to see more about this series of NCS National Care Service orientated discussions and opinions and wider Alliance work on that, you can see it on our website, along with everything else we're doing, which is www.alliance-scotland.org.uk. And the only thing left to me is to thank Meg very sincerely for joining me, and thanks for listening.
Thank you for having me.